What is restless leg syndrome? Restless leg syndrome, RLS, is a complex and relatively common neurological disorder that can significantly disrupt an individual's quality of life, especially by causing serious sleep problems. This condition is characterized by uncomfortable sensations, typically described as burning, tingling, or itching in the legs. These symptoms usually manifest during periods of rest, particularly at night and during sleep, and are only relieved by moving the legs. Imagine every time you try to peacefully fall asleep, these uncomfortable sensations force you to move your legs or even get out of bed. This not only disrupts your sleep but can also lead to extreme fatigue, decreased concentration, and even depression. Interesting facts. RLS occurs almost twice as frequently in women as in men. About 5 to 10% of the US population is affected by some form of RLS. This condition can appear at any age, but it is most prevalent in middle-aged and older adults. RLS is a chronic condition, meaning it can last for years and worsen over time. The relationship between restless leg syndrome and diabetes. The connection between diabetes and restless leg syndrome is an important area of research in medical science. Diabetes, particularly type 2, can directly and indirectly affect RLS. These two conditions often coexist, and diabetes can increase the risk of developing RLS or exacerbate its symptoms.
1. Diabetic peripheral neuropathy. Peripheral neuropathy is one of the most well-known complications of diabetes. This condition occurs when peripheral nerves, especially those in the legs, are damaged due to prolonged high blood sugar levels. These nerve damages can cause symptoms like burning, pain, and numbness that closely resemble those of RLS. Studies suggest that 20 to 30% of people with diabetes also develop RLS, indicating a strong link between these two conditions. 2. Iron deficiency and its role in diabetes. Iron deficiency in the body, particularly in the brain, is a key factor in the development of RLS. Diabetes can alter iron metabolism and increase chronic inflammation, which in turn can lower iron levels in the body. This reduction in iron can increase the risk of developing RLS in diabetic patients and exacerbate its symptoms. Iron deficiency directly affects the production of dopamine, a key chemical in the brain involved in movement control. Insufficient dopamine can lead to increased unwanted neural activity and RLS symptoms. 3. Circulatory disorders. Diabetes can cause vascular problems, including reduced blood flow to the legs. This circulatory disorder is another potential factor in worsening RLS symptoms. Reduced blood flow to the legs can enhance the uncomfortable sensations, increasing the need to move to relieve them. Additionally, diabetes can lead to atherosclerosis, hardening of the arteries, further restricting blood flow and worsening RLS symptoms. Note: in people with diabetes, the likelihood of developing restless leg syndrome is twice as high as in non-diabetics. Strict blood sugar control can help reduce RLS symptoms in people with diabetes and improve sleep quality. Some studies have shown that iron supplements can improve RLS symptoms, especially in patients with iron deficiency. However, iron supplementation should be done under medical supervision to avoid potential side effects. Conclusion: the connection between restless leg syndrome and diabetes is complex and multidimensional. Diabetes can significantly exacerbate RLS by affecting nerves, iron metabolism, and the circulatory system. Therefore, strict diabetes management, monitoring iron levels, and employing appropriate treatment methods can not only help reduce RLS symptoms but also improve the quality of life for those affected. Paying attention to this connection is crucial, as early identification and treatment of RLS in people with diabetes can have a positive impact on their overall health, particularly in improving sleep quality and preventing further health complications. Thank you, dear viewers, for watching this program. If you found this content helpful, please like it, leave your comments below, and subscribe to our channel for more content.